Dr. London is calling. Hello, welcome back to my channel, Student Dr. London calling. If you haven't already, please like, comment, subscribe, just to make sure that you are getting those notifications when the new videos drop. They drop every other week, 2 weeks, that's what I said that. But every other week. So today's video, I decided to call up someone who's very special to me, my mom. She is going to talk about patient advocacy. My mom was diagnosed with breast cancer in 2014, and that progressed to heart failure. She had to be placed on the LVAD, which she was on for 3 years, and then she had a heart transplant, and now she is currently waiting for a kidney. And we just found out that my dad was a match, so we're expecting that procedure to go well this year. So my mom wanted to come on, or I asked my mom to come on just to talk about patient advocacy, because a lot of things that my mom went through, she found herself, or she fought for herself and made sure she had the perfect care team. And as a Black woman, during this journey, her pain was dismissed most of the time. So it is important for the minority community for not only listen to your body, but also to be aware of what is happening and to fight for yourself. So, further ado, here is my mom, and she picked up the call.
Hi, London. Thank you for calling your mommy, Student Dr. London. But anyway, I'm Miss Wheeler, Diona Wheeler. I'm London's mother, and I was so excited when she asked me to participate and talk about some things that I've dealt with in my testimony, but also, more importantly, talk about advocacy as well as being compliant. Now, many of you know what I've gone through, but many of you don't. So I want to share a little background story so you understand why I say the things that I say. Well, I'm a breast cancer survivor. I had breast cancer starting in 2014. And I had a double mastectomy. I had all the treatments, radiation, chemotherapy, the whole 9 yards. And I'm here to tell you that I'm living without breast cancer today. So I'm very, very grateful for the doctors that helped me get here. And more, what I really want everybody to understand, the audience, is that I was compliant. A lot of people tried to approach me and say, oh, why don't you go holistic? Just take these vitamins, just do this, just do that. Yeah, it's great to be holistic, of course. You want your body to be whole, and you want to be able to eat those proper things so that can fill your body up with the nutrients that you need. But you have to be compliant. The doctors are here for a reason. And I'm a woman of faith, and I love God, and I trust Him, and I believe in Him. But trusting in the doctors does not mean, or shall I say, believing that the doctors can do what they say they're going to do based on their experience and the longevity of understanding breast cancer. I trust God in them. Everybody's here for a reason. Everybody's here for a purpose. So why not the doctors? So I was compliant, listening to them, doing whatever they told me to do. And now I no longer have breast cancer. And it's sad to say that many people out there that I've known, that I don't know I've known from other people, that they're no longer with us because they just trusted being holistic only. They didn't think about listening to the doctors and being compliant. So that's a huge piece throughout my survival of 5 deadly illnesses: breast cancer, I had a stroke, and I didn't even know I was having a stroke. The stroke came 24 hours later, or meaning I found I had a stroke 24 hours later. So I thank God for that. I survived that with no residual. And I had what you call, a lot of people don't know what it is, but I had sepsis, which is a blood, not as a disease, but it's a blood infection. And I survived that. And I also had heart failure, congestive heart failure, where I had an LVAD, which is a left ventricle assist device. I had that for 3 years until I was able to get a heart transplant. So now I currently have a heart transplant and awaiting a kidney transplant, which is right around the corner. But I say all that to say is that I was an advocate for myself throughout my process or throughout all my illnesses. I was an advocate, meaning that I told the doctors what I was feeling, what I needed, what I expected. We're the only ones that know our own history. So you have to tell the doctors, include them in on what you've done, where you've been, your history with your family members. And they can't guess. They can only ask you the right questions. And you have to answer it. But also be more forthcoming with what's going on in your life. Stop trying to hide. Tell the truth. That's part of your healing process. And I'm a powerful praying woman. So obviously that made a huge impact on my mental, my physical, and my emotional state. But also I want you to clue in on advocacy, but being compliant. Listen to those who are in the industry, in the medical field, who know more than you. Don't go on Google trying to figure out what your diagnosis is. Google does not know what's going on with you, your history. They're doing a blanket study on some certain things, but they don't know you. They don't know your name. They don't know anything about you, nor do they care. Your doctors care about you. They took an oath to take care of you. So I just wanted to restore hope in you for the medical professionals. My daughter is going to be a doctor real soon, and I trust the information that she knows, that she gathered based on experience and science. Trust your doctors. Be an advocate for yourself, and also be compliant. Thank you, London. I will always pick up for you, baby. Thank you for allowing me to be a part of this message, this movement that you're creating to help the underserved, as well as to just restore hope back in medicine. Thank you so much. I love you. Bye. Bye, audience. I hope you listen. I hope you understand. I've been through 5 deadly illnesses, and I came out looking like this. I can talk, I can speak, I can walk, and I can hear you. I can talk to you, I can speak to you. And I just thank God that I'm a witness to his power, as well as the people who he bestowed those wonderful gifts, those doctors. Thank you, London.